All right, sleep apnea is something that is going to occur while people are sleeping. They stop breathing. There's about 10 to 20 seconds or longer where they stop breathing, and this does cause a lot of disruptions in their sleep, which obviously would increase fatigue, and it's very common in people who are overweight, but it's just kind of like a blockage of the throat, and so that's just some of the stuff. So people underweight can have sleep apnea, but it is very common with overweight. So you have two different types, obstructive and then central. Central is the central nervous system fails to initiate that breathing, and then the obstructive is that it's blocked because air is unable to enter the lungs. So that's the two different types that you have there. So the fix is you can wear a CPAP, which is just a machine that is going to force air pressure in so that you will breathe. And typically once they adjust to the machine, they usually overcome their fatigue and feel a lot better. Sudden infant death syndrome is also known as SIDS. It's a very sad symptom, or I guess disease. We don't really know what it is. It's where an infant 12 months or under will just stop breathing and die in their sleep. It's something that's super heartbreaking. We don't really know the cause. Right now, we know that if you let babies sleep on their back, that helps to prevent it. We see it's a greater risk in boys than in girls. A couple of contributing factors that we see is a premature birth, someone who smokes in the home, and then hypothermia, that baby getting too cold. But we really don't know what happens or why it happens, but it is something that's very horrible. Narcolepsy is whenever people aren't able to keep themselves awake and they just fall asleep during waking hours. It can be triggered by heightened arousal or stress, and it does share many of the features of your REM cycle sleep. So there's two different types that you have there. The cataplexy says it's a loss of muscle tone while awake, or in some cases, complete paralysis of the voluntary muscle. And then the hypnagogic hallucination would be vivid dreams that are occurring and that hallucination. And there are different psychomotor stimulant drugs that can be used to treat it, to help with it. Substance disorders are going to be described as compulsive pattern of drug use despite negative consequences. So if you're not familiar with the DSM, it's the Diagnostic and Statistical Manual of Mental Disorders. The 5th edition is the current edition that we are in. And that's really the psychological Bible. It's going to tell you any and every psychological disorder that we have and the most current definitions for it. And it gives you the guidelines. Well, it gives people who are licensed and know what they're doing to be able to diagnose individuals with these disorders. So you have to meet every single criteria that it says. You can't just be close enough. So it's really important, though, for you to be able to realize that when you're diagnosing that, you can't just be close enough. So you can have physiological dependence with substance use disorder, or psychological dependence, or both. Physiological is going to be where your body needs it, and if you'll have withdrawal without it. And so withdrawal and tolerance are going to be present. Withdrawal, you probably are familiar with it. It's those flu-like symptoms. It's just a horrible detox from your body, and it can happen within hours of being away or out of the use of the substance. And tolerance would be where we have, it takes more for us to get the same feeling that we had before. And they say that everyone who's using drugs is always chasing that first high. So they're always trying to feel that way that they did before. But the more we use, the more it's going to take for us to be able to get that same feeling. So the criteria for the substance use disorder, according to the DSM-5, is listed right here. So it's a problematic substance pattern of substance use leading to clinically significant impairments or distress manifested by at least two of these following within a 12-month period. So you have to have 2 of them for 12 months or longer. You can't have one for 11 months and then one for 12 months. You wouldn't have a substance use disorder, okay? So the substance use is often taken in larger amounts or over longer periods of time. A lot of addicts you hear, I mean, nobody goes into it saying, I really want to be addicted to this and I want to run my whole life, okay? Usually they're trying to stop. They have efforts where they're trying to cut back, and even when they're trying to, they're still continuing to use. They'll even spend a lot of time trying to obtain the substance to recover from its effects. All of that stuff. They'll have a strong craving or desire and urge to use the substance. Even though it's causing issues at work, fulfilling major roles, people are still trying to get access to it, interfering with their social life, interpersonal problems. It's making it bigger and worse. Even willing to give up really important social events, occupational, recreational activities, all of that for the drug. Even though it's all really horrible for you. When you have an addiction, that's all you can think about and that's all you can do. And then we talked about tolerance and withdrawal. And so those are what were some of the symptoms that you have to have for substance use disorder. Now, for you to have a mild substance use disorder, you need 2 or 3 of those symptoms out of the 11 would be mild for the 12 months. The presence of 4 or 5 would be considered a moderate for that 12 months, and then 6 or more is a severe substance use disorder. And this can be with physiological dependence or with without physiological dependence. Okay, so there's either evidence of tolerance and withdrawal, or there isn't any evidence of tolerance or withdrawal. So I had a student one time that he had open heart surgery. And he said it was the most painful thing he'd ever experienced. And then he went to, had to use a bunch of medication to overcome it. And that was so painful. He finally ran out of the prescription, and it was still so painful. So he started to get it off the streets. He was using like oxycodone or something, and he eventually got to where he couldn't really afford it. But heroin was really cheap, and it did the same thing. And so he eventually started using heroin and became a heroin addict. It was never his goal to do that. It just started from the severe pain. And then it got to the point where he just couldn't control it and had to have it, and his body became dependent upon it. So it usually starts out that whatever reason they start, boredom, pain, whatever it is to escape. And then that tolerance, we need more and we need more. And then if we're about to run out, we'll take whatever gives us that same high. For instance, if you are addicted to caffeine and you didn't get your morning coffee, you'll drink a soda later so that you don't get that caffeine headache. So we will use whatever we can that's going to be similar enough. All right, psychoactive drugs, you have a stimulant and you have a depressant. Stimulants are going to be increasing the activity of the nervous system, while depressants are going to decrease it, sedate, lower the central nervous system, the activity of it there. So cocaine, okay, this was a miracle drug back in the day when we first found it. So before, when you had the coca leaf, if you chewed on the coca leaf, then it had these like wonderful medical properties that made us feel better, not give you that high. It was really healthy for you. So we took it, we stripped it, and all of a sudden we created cocaine. And we thought it was good. We had no idea it was so horrible. Okay? They used it for toothache drops. They used it for everything. They put it in Coca-Cola. It relieved exhaustion. They used all kinds of stuff because they didn't know it was bad. I mean, think about all the commercials we have today. If you used this, then you may be liable for this. They didn't know. Okay? With the 7-Up, they put lithium in it. They put amphetamines. It settled your stomach. You ate less. It was slenderizing. Okay? Depressants, so those are kind of a couple examples of our stimulants. Depressants are going to be drugs that are going to suppress that central nervous system. Okay, so they're usually a GABA agonist. Okay, remember we talked about an agonist is going to have quieting effects on the brain because it binds to the receptors that then to make the neurons less likely to fire. Okay, so here's your list of the different ones there. So they're just kind of calming things down and helping to be able to relax more. Alcohol is under the list of a depressant. And so some of the issues we have with alcohol is that it's really legal to use without a prescription. I mean, we say age of 21, but honestly, if people want to get access to it, they can because their parents may have it. Someone may buy it for underage. So it's really accessible. And the bad thing is that we use it for all these positive events. Maybe we had a long day, so we need to relax. Maybe it's going to help us to sleep. We're going to have a party. Let's celebrate. Let's use it for that. We think of it as exerting maturity because you have to be 21, so it's an older thing. It relieves anxiety, relieves depression. And there's no social stigma in public. So if I were to see you down at the Art Walk on Main Street in Denison, and I was carrying a glass of wine, looking at all the art, you're probably not going to think anything of it. Now, if you see me on Main Street at the Art Walk and I'm shooting up heroin, you're going to think some horrible things of me because there's a social stigma to drugs, but there's not to alcohol. And so that's what makes it so dangerous, is that we encourage it. If you have a stressful day, it's totally fine for you to put on social media that you need a margarita at 10 a.m. Whereas it wouldn't be okay if we said that about drugs. So it's something that's problematic because it's so acceptable. It is an issue we have with college students. I'm sure you guys are aware that 80% of students report multiple consequences from alcohol, whether that's drinking and driving, being hurt, injured, sexual assault, rape. There's lots of serious accidents that can happen, poor grades, aggressive behavior. And so binge drinking is defined as 4 or more drinks for a female and 5 or more drinks in a row for a male. So effects of alcohol in low doses, it's stimulating. The alcohol dilates the blood vessels, but the problem is when you have higher doses, it becomes a sedative. So then it impairs your cognitive functioning, your speech is impaired, your motor coordination is slower, and your inhibitions are lessened. Okay, whenever someone is drinking, they have no problem to yell across the room that they think someone is attractive, whereas like Raj on The Big Bang Theory, he can't even talk when a woman is around because he's got so much anxiety and overwhelm. But if he has alcohol, it's totally fine to talk about to them. So it is also important to acknowledge that alcohol is involved in half of all fatal car accidents in the U.S. And we found that women are less likely to become alcoholics than men simply because of their biology. In your stomach is the only place that you, when stuff hits your stomach, it breaks down and it goes to your intestines and you get your nutrients from there. But when alcohol hits your stomach, that's the only thing that secretes into your bloodstream from your stomach. So women have different enzymes within their stomach, and so their enzymes are less likely to break down the alcohol, and so that's why they feel it faster and more. Whereas men, it'll break down faster, and so it takes them more to feel the same thing. So while women can become alcoholics, they're less likely to overindulge simply because of that metabolic breakdown. So check out this video. It's a good video to see just kind of the story of an alcoholic. I'll tell you the good news of Leslie is that she does overcome, and she becomes a drug and alcohol counselor. So there's a positive side to it. There are possible effects from chronic alcohol abuse. So here's a list of some of the things you can have. Cirrhosis of the liver would be one. Because the alcoholics are drinking and they're not eating what they need, and alcohol doesn't have protein, so then that makes the person more at risk for cirrhosis of the liver because of that protein deficiency. They can also have the delirium tremens, DTs. That's just your sweating, restlessness, disorientation, hallucinations, all of that from someone whenever there is a chronic decrease in the usage of alcohol. And nutritional deficiencies, again, because they're not eating, they're drinking more, than they're eating, and there's nutritional deficiencies. And then you can have Wernicke's-Korsakoff syndrome,